Let's discuss the latest now on the pandemic in more detail. Joining me now is Dr Chaand Nagpaul. He's chair of the British Medical Association. Also joining us, Professor Melinda Mills, Professor of Demographic Science, also sits on the SAGE Group for Behavioural Insights, and Dr Bharat Pankhania, Senior Clinical Lecturer at Exeter University. Thanks very much, all of you, for joining us. We've been asking people on Twitter and on our websites to get in touch with us with their questions. Lots of people have questions, Dr Nagpaul, about the dates of various boosters and things that they may have had in the past. But let's start with Dr Bharat Pankhania. One question has come in from Sean on Twitter. He says, why are we not testing for antibodies routinely? Wouldn't this help us ascertain immunity in the population?
Yeah, Sean, the short answer is that measuring antibodies is a imprecise science. And if you think about it, Sean, we've also got to take a needle, a syringe to your arm, take some blood out, send the blood to the laboratory, get it analyzed. So it is a long, tortuous process to look for antibodies. It's expensive. And furthermore, the test for the antibodies is not precise enough for us to say, I see antibodies, therefore you are immune.
Right, so it's not very efficient and it's not very precise. Pretty clear answer there. Let's move along the line to Professor Melinda Mills, a demographic scientist and also behavioural expert. Another question, is it good public health policy to force people to be vaccinated or face restrictions and discrimination, both socially and medically? So clearly coming from a political angle, but in more general terms, does it work, good public health policy, if restrictions are implemented? Do people tend to stick to them?
Yeah, so the question is about whether, mandatory vaccines would be brought in, and that has been discussed in some countries such as Austria and Germany, but that hasn't been the discussion here. So because generally, other things like incentives can be more effective in people understanding why they need to be vaccinated and how it works, because really we have this large middle group, and some people aren't vaccinated because they still have some safety concerns and they want to discuss it more, and that's why we should have more dialogue. And there's just a very small group that is actually against it for other reasons, often non-medical. So, things can work such as, sending reminders to people, making it convenient, having longer opening times. And we're really experiencing that now that, when the Prime Minister gave the announcement on Sunday, you had this rush of people actually wanting to have the vaccines. And as you were just discussing, there's people around the world that are really, desperately wanting to have these vaccinations. So I think in general, the public has really adhered and has really listened to these things. And as we enter into the winter period, they're understanding, why they have to wear face coverings, why vaccinations are important. So we can anticipate the similar amount of adherence, I would think.
Dr Chaand Nagpaul, Lauren has written in. She says, is there any known difference with catching the Omicron variant during pregnancy? I'm double jabbed, not yet, though, in the window for a booster. Should there be any further guidance for those who are pregnant?
Well, the Omicron variant has only come to light very recently, and I haven't come across any government guidance that is specifically about Omicron. What I would say is that because we know that pregnant women are at higher risk of complications or severity of illness, what should be done is to take extra precautions not to put yourself at risk if you're not yet eligible for the booster. What that means is that the measures around physical distancing, not mixing in crowds, and what we at the BMA are promoting is that the public, and especially pregnant women and others who are vulnerable, should be wearing FFP2 masks. These are higher grade masks that protect the wearer as well as preventing transmission to others. So those in higher risks should be wearing, in our view, higher grade masks. They're readily available from any high street pharmacy, readily available online as well.
OK, good advice. We've just heard some breaking news that the Shadow Chancellor, Rachel Reeves, has tested positive for COVID-19. Dr Pankhania, of course, the day is the day that the regulations change, don't they? If you've come into contact with somebody who has COVID-19, you don't have to now self-isolate. You can do daily lateral flow tests. Is that a concern for you in terms of the spread of the new variant and the old variant? Do you think numbers will go up because the regulations have changed?
Yes, I do. And this makes my job as an infectious disease expert difficult, very difficult, because we all know that the lateral flow devices are not accurate. There are two issues here. One, the accuracy per se, and the second bit is how well did you do the test? And I'm often in outbreak control meetings saying, unless and until you do a really good sample taking, then your test is meaningless. So with respect to lateral flow tests of contacts on a daily basis, it is a flawed process. The flaw being you can game it. Nobody's checking, nobody's scrutinizing whether, number one, you really did the test. Number two, did you do it properly? And number three, we know inherently that the lateral flow devices have an inbuilt inaccuracy.
However, I suppose, Dr Pankhania, you could say that those who are self-isolating for 10 days could also game the system, couldn't they? They are not being checked every day throughout that 10-day period, so we are going on trust, aren't we? Professor Melinda Mills, social distancing, this is a question from Sue. She says, previously under COVID alert level 4, social distancing was in place. Is this the case now? And if so, why are people not being advised they should be social distancing? Are people still social distancing, whether it is in the regulations or not, I wonder? Just subconsciously, I certainly feel that when I'm out and about, I step back when I talk to people. I don't stand as close to people as I used to. Has there been a change in society and how we interact with people?
Yeah, so we looked at multiple self-reported surveys, but also CCTV data reports about that. And what we saw over time, particularly in July, when the message was given out that there could be a relaxation of some of the restrictions and some of the interventions, and we definitely saw a drop across all things. People were encouraged to go back to work. We saw a drop in face coverings and also social distancing. So I think those kind of are really quite important that people now understand, and there has to be some more clarity in messaging, because people, need to know, okay, well, what do I need to do? What setting is it in? Why is that new? And why would I need to do this? And as soon as you clarify this, and I think Chris Whitty has said it on multiple occasions, as soon as people understand, why they need to do it and the urgency of it, they will do it. But I think Sue's raised an important issue that there has been sometimes a lack of clarity. We can think about face coverings, for example, when they were only in certain spaces, such as transport or in shops, and people started to wonder, well, why not in this space and not in another? So I think in clarity of communication will be another important thing, particularly as we go into the holiday period.
So do you think more government messaging would be useful? Because it does perhaps feel quite a while since the hands, face, space logo was foisted upon us repeatedly. We don't sort of hear any of those messages anymore, do we?
Well, I think also the science has evolved, and it's not that people have been incorrect, but there's a clear understanding now, transmission via aerosol transmission and droplets. So ventilation really has to enter into that factor as well. And also that idea about social bubbles that we all, grew to understand, that you should have repeated contact within the same networks of people over the period, that you should make sure you open the windows because it's a winter period now. And, all of that messages, I think, it can't be repeated enough. And as soon as people hear it and they understand and they have some control and know what they need to do, people will generally, understand that and adhere to it.
OK. Another question from a viewer concerned about their safety, Dr Nagpaul. This is from Anne, and she says, my daughter's partner had COVID 2 weeks ago. He's well now and has antibodies. She has an autoimmune disease, rheumatoid arthritis. Is it safe for her to spend Christmas Day with him, or could he still transmit the new variant to me? There's a lot resting on this answer, Dr Nagpaul.
Sure. Well, if he's recovered from COVID 2 weeks ago, of course, it could have been the Delta variant. and he may still be therefore susceptible to getting infected with Omicron. Now, I think that the important point is that those who suffer with autoimmune conditions or have any other vulnerable medical condition that places them in a vulnerable position should be taking extra precautions now, not wait till when you meet someone at Christmas, but now. I said that earlier that you should wear a medical grade mask, an FFP2 mask, so when you go out, to prevent yourself becoming infected, protecting you as a wearer, but also being very careful about mixing. I think by taking those measures, you reduce the likelihood of being infected and possibly transmitting it on to loved ones at Christmas. The other thing that, and I totally agree with Bharat, that there are limitations on lateral flow tests, but if they can be done properly, and it does mean watching a YouTube video as well as reading the instructions, they can be done properly and they're done sequentially. There is a pickup rate that if you are an asymptomatic carrier, it will show that you may be infected. And taking those precautions before you meet your loved ones at Christmas is important. The third is how you meet people. It's not just about meeting. You can meet people in a crowded room at Christmas, in a crowded living room, or you can meet with a good ventilation, which makes a huge difference to the risk of transmitting the virus, and also with more spacing out and having just fewer people in the room. So there are those measures that will also reduce the risk.
So just to summarise for Anne, you're saying that her daughter's partner may not be potentially passing on Delta, but they could potentially have Omicron, you know, if they've got over Delta. That's correct? Yep.
Yes, because because 2 weeks ago, Omicron was not particularly prevalent in the UK. So if you were to have got COVID 2 weeks ago, there was a high chance it was Delta. And if it was Delta, that doesn't make you immune necessarily to Omicron. You're still at risk. Certainly, I hope that both the partner and herself should have a booster if they're both eligible, but also recognizing that it will take some days after the booster to be fully protected.
Okay, and the other advice, wear FFP mask. They should all test before they get together and do lateral flow tests and open windows. Dr Pankhania, you were shaking your head during that. I'm just checking, you know, whether or not you disagree or whether you were agreeing there, because one of the other questions was from Joe, who said, linked to that, can you contract Delta and Omicron at the same time if they are significantly different strains, or one after the other?
Yeah,
indeed?
so let me answer both. So I was shaking my head because I was saying, look, the gentleman has recovered from his Delta or whatever infection it was. There is every possibility that the partner or both the partners can get reinfected, and therefore you take precautions. But if her specific question is, can we meet over Christmas? My answer is yes. He has recovered from his last infection, and therefore continue with your infection control measures and do meet, don't cancel your meeting. So in answer to the second question, I would say, yes, of course, you can have dual infections. You can have an Omicron infection as well as a Delta virus infection. The processes are the same. The recovery is the same. Some people, unfortunately, end up in hospitals, and the best way to prevent that is to be fully boosted.
Okay, so you can have them both, one after the other, or both at the same time. That's useful to know. Professor Melinda Mills, that there is obviously this big political debate happening in Parliament today about further restrictions. It seems that a lot of people have very entrenched views about it. Some would describe some people as being anti-vax, some vaccine hesitant. As we move on through how this disease has been presented and how people have reacted to it, once somebody has decided that they're not getting a vaccine, is it very easy to change their mind, or is that once that mind is made up, is that it?
Well, we've seen various opinion polls about, you know, how large is that group? And that group is actually quite small, that is absolutely against getting vaccines. Remember, there's other groups such as those that have allergies or medical reasons. So we're not talking about that group that's exempt. But actually, there's just a really large middle group, or some people that have had their first vaccinations, but not the second dose, or that haven't come forward for the booster shot yet. And that's for various reasons. And I think we often forget that it could be complacency. So, for example, it could be, younger people thinking, well, wait a minute, I don't risk hospitalization or death. And I think we have to shift, the narrative and thinking more about, it's not just about you, about whether you're vaccinated, but we have to reach a sufficient level of immunity within the population. And that's why it's important for, younger individuals, and why they're having that discussion as well about age 5 and up. And that's why it's so important for the population to, as many as possible to become vaccinated. And specifically, since we've had this discussion about second doses and booster doses, it's very important to have this dialogue. And we know that there's just many different reasons why, and they're not always that people are against. There's just a large group in the middle that just needs some more information. They need some more community dialogue. They might need a mobile van, coming in their neighborhood because they have time. They find it difficult to get time off work. So it's a lot more reasons than just people being against it.
Interesting. Yeah, a lot of it's just about the access to it. Dr Nagpaul, a lot of people worried about Christmas and plans. James has got in touch. He says, my 12-year-old son had COVID late October. We need to wait 12 weeks until he can be vaccinated. That takes us right into mid-January. Should I wait the full 12 weeks, or is it safe for him to have it sooner? It's hard to keep up with the guidelines as they change so frequently. So should a 12-year-old who had COVID in October be getting jabbed now, or should he wait?
Okay, so I will actually have to defer to Professor Pankhania as an expert in terms of vaccinations and immunology. But what I would say is that as we approach the end of December, although the government has said all adults will receive a COVID booster or be offered, there'll be about 11.5 million patients, like the example you've given, of people who will not be eligible for a booster because they've either not received a vaccine, or they've only received one, or the second was given too recently to make them eligible. So we're going to have to go into the new year with continued infection control measures. The booster program, even if we were to deliver it by the end of December, will not be sufficient to protect the nation. And now, in terms of what you should do over Christmas, I think the message that I've given before is you need to meet safely, and there are a host of issues to try and protect yourself before you meet others at Christmas. To make sure you meet in small numbers, you have a ventilated area, you have physical distancing wherever you can. All of those things will make a difference, including, I know it may not be socially acceptable, but you can actually also wear masks, with people to try and reduce that risk. But in terms of whether the government should change its rules around shortening the duration of time between the second dose and the booster, that's not a decision for me.
No, well, Dr. Pankhania, do come up on that, because it was interesting listening to the politicians questioning the experts this morning. Their explanation of why we wait so long for the vaccine, because actually it does work up to that point. It is a waste of resources, a waste of money in one sense, getting the booster early, but also it brings the problem 6 months closer down the line, doesn't it? If you have the booster early, then in 6 months' time you've got the same problem. But balancing that against the need to vaccinate people to prevent Omicron infection.
Yes. So if we recall, we initially had a 6-month interval between having your 2 primary courses followed by a booster at the 6-month interval, and that has been shortened now. And in answer to the question about the gentleman's son, should he have the booster, my answer would be yes, he should. And my reasoning is as follows. The infection that his son had in October is now well and over. We're in December, so that's 2 months gone by. All his immune systems, etc., will have settled down, calmed down. And now, if he were to have his booster today, it would be perfectly fine, and there would be no cross interference and reduced immune response as a result of getting the jab in December rather than in mid-January.
Okay. Professor Melinda Mills, I wonder whether, when we talk about people who are hesitant, people who've decided not to have the vaccine, rather than perhaps the people that you were talking about earlier who just haven't got it for various reasons to do with logistics and things. In terms of scepticism towards the medical profession, a lot of people suddenly seem to think they're the experts because they've read a few things online. Is that different now to how it was, I'm thinking back 100 years ago, obviously we didn't have the internet and social media, but have people always been sceptical of medical intervention? Are more people sceptical now, or will there always be a percentage of the population that are sceptical?
We've seen a few changes over time. So definitely we see similar messages almost completely. When smallpox, when the vaccination first was introduced, we see similar sort of discussions about it, which is interesting because that's, over 100 years ago. But actually, there's a few things. One is that we have a different sort of information sources now. So there's been multiple studies that have shown that people that get their information from sort of alternative sources, particularly such as YouTube or TikTok or some WhatsApp groups, they get fundamentally different types of information that hasn't been fact-checked and is often more negative and often less given by experts. And another thing that we found also, we've published a survey, looking at trust in government, and we're expanding that internationally. And really what you see is if people have a low trust in government, they see role models not doing similar things to what they've been asked to do, but also just, looking at inconsistency in messages, that gets very confusing for people. But what we found is that people, and others have found this as well, people have high trust still in experts, in medical experts. So, people such as the chief medical officer or people from the UK Health and Security Agency, they still, understand that, they're doing something for the public good. And sometimes they can be more skeptical about the government or politicians. And that's around the world, but particularly the case in polarized societies such as the UK, the US, or Brazil.
How interesting. Well, Professor Melinda Mills, great to talk to you, and a great deal of confidence in the words that we've had today from Dr Chaand Nagpaul and Dr Bharat Pankhania, fine experts, all of you. Thank you very much for joining us and answering our viewers' questions. Appreciate it.